Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Catherine Andrioli, and today we're talking about seasonal affective disorder. Doctor, what is seasonal affective disorder, or SAD?
Seasonal affective disorder is a cluster of symptoms that people experience during the darker months of the year, and it commonly includes symptoms of irritability, irritable mood, low energy, oversleeping, increased appetite, and weight gain. And it's almost what one would think of as a hibernation syndrome, that people get these kind of symptoms in the darker months of the year.
How long do these winter blues last?
By itself, it would be self-limited, although, we're talking about several months until we get to like March, April, when there's a lot more sunlight. People will be suffering from these symptoms. So, it can go on for many, many months.
Who's most likely to suffer from SAD?
Women, more than men, younger people, people with a family history of SAD, people who have a history of depression, and people who live far from the equator, like here in Massachusetts.
What can someone do who has SAD?
Well, I think the most important thing is that someone should be evaluated as to whether or not they have SAD. To make the diagnosis of SAD, you would need several darker month periods, several winters where this has occurred without symptoms during the lighter months, during the spring and summer. But it's important to note that people who suffer from depression, or what we call major depressive disorder, do have worsening of their depression in the darker months. And so those people would have a different treatment because they actually are suffering from a depressive illness that's not just limited to the winter. But if someone does have seasonal affective disorder, the most common treatment is light therapy. And the light therapy can be purchased. There are helmets that people have that shine a light. Very commonly, people will have lights that are on their desks. And it's very important for this to work, for the light to get into the brain. And you might ask, how does it get into the brain? Well, it gets into the brain through the eyes. Now, people shouldn't stare right at the light, but people have to look up periodically so that the light, let's say it's on their desk, gets into their eyes. Psychotherapy, particularly a form of psychotherapy, talking therapy called cognitive behavioral therapy, can be effective. And also medications can be effective. But usually the first treatment for someone with classic seasonal affective disorder would be the light therapy. One other thing I would say is that this time of the year we change the clocks, and we move the clocks back 1 hour. And this is different from seasonal affective disorder, but it also affects really everyone. And there are studies that show that after we turn the clocks, the next day, or actually the next week, there's an increase in car accidents, and there's an increase in people feeling depressed. Now, that's not SAD. I mean, if you think about it, we've had declining light in this part of the country since the end of June. But that abrupt change in the clocks can often throw off people's circadian rhythms, and it's thought that's why there's this increase in car accidents and depression in the week or so following the change in the clocks.